This is Waves, a podcast from APTA Michigan. I'm Andy Wicks. Today's episode is the first in a two-part series featuring two hilarious and wonderful people who also happen to be excellent physical therapists, Dr. Nikki Pappas and Dr. Sara Wallace. They work at the VA Medical Center in Salt Lake City, Utah, and have been giving a talk you may have heard called Healing Out Loud, which espouses the importance of being vulnerable and curious as ways to improve our connection with patients as well as coworkers, all in the name of better patient care and better self-care. Please enjoy the wacky shenanigans of Nikki and Sara.
Okay, well, I'm Nikki, and welcome to the Nikki and Sara Show. We're really fond of it. We actually work together at the VA Medical Center. We're acute care physical therapists. I am...
Where? The VA Center where? Sorry, there's many of them.
Yeah, we are Utah kids. We are
Salt Lake City.
Salt Lake City, Utah. And I am a geriatric clinical specialist, and I am the CI that gets the most students at our site. And I'm also associate instructor for the University of Utah. I teach for their patient safety and handling. And I teach all the initial DEI stuff for them.
Oh, very cool.
Yeah, I'm Sara Wallace. I am an acute care physical therapist at the VA. I'm also the site coordinator of clinical education. And so I coordinate all the students and send them Nikki's way. On the busiest floor, and she is such a good educator and a good clinician, and so it's really helpful to have students spend time with her, and it doesn't wear her out. So other people need a break, Nikki does not. So I coordinate that. And I am not a specialist.
By the APTA standards,
yeah.
But you are a boss, dude.
I'm gonna really test my editing skills here. This is gonna be fun. I mean, we're not even 2 minutes in, Nikki.
Girl, I was given the okay.
You are. This is on me. This is my own.
And I really, really love clinical education, and I will start teaching at the PT school in the spring semester, teaching their teaching and learning. How many times did I say teaching?
6.
Okay. And so teaching and learning in the spring, and I don't know. I got kiddos and a dog and a husband, and
yeah.
Busy Salt Lake City life.
Nice. So Nikki, you have been teaching, and Sara, you're about to start teaching?
Yes.
Nice.
Yeah, I've been doing both of my jobs for about 10 years.
Nice.
Yeah, it's really neat.
Fantastic.
That they would let me work both of those jobs because I love both of those.
I met the two of you at ELC in Philadelphia.
Can you say what ELC stands for, Andy?
I will say that.
Uninformed.
Thank you, Catherine. The Education and Leadership Conference put on jointly by the American Academy of,
Academic Physical Therapy.
The American Consortium of Academic Physical Therapy, ACAPT, and the Academy, whatever the education section is of APTA, which I think is an academy now. I should know this. I'll look it up later.
Well, they changed a lot of it last year.
They did.
And it's a little bit tricky.
They did.
Who's an academy? Who's a...
Yeah. And I noticed, first of all, that Nikki and I were going to a lot of the same sessions because, as you can see, if you're watching this, and as you will hear as I'm saying this, she has purple hair. So she kind of stuck out. And I also noticed that you tend to sit a lot closer to the front than I did. So I just,
We're front row kids.
Yeah, I'm not. I'm a back row kind of kid.
Yeah.
I'm
a back row person too.
But see, Catherine, you and I empathize because we're both pretty tall. And I feel pretty self-conscious if I'm sitting up front because I always feel like there's someone short going to be behind me and then they're going to be going a lot. And I don't want to. So I'm in the back.
I just feel I learn better when in the laid back environment of the back row.
Catherine, I think we need to talk about being honest with yourself and just, you don't need to lie. You don't need to sell it. It's okay.
Well, and Andy, let's just throw one extra thing in here, and that is that the reason why we knew who you were during our presentation is because you were in the front row of the seats, but you were in the front row of the people.
You were?
Yeah.
You were in
So
very front.
And full disclosure is because I got there late, so I was like, now I got to go up front because
that's a bold move, though.
That's
Like,
bold.
to come in late and then think I'm just going to confidently walk to the
Well,
front.
and everyone in there. So these rooms that we were in were kind of these long, skinny rooms, kind of weird logistically. And people had spaced themselves out as people do, where there's like one seat in between two people that don't know each other. And I'm like, not going to be the guy that sits between two strangers when there's other. So anyway, but yeah, so I went to their presentation and it was entitled Healing Out Loud with a long subtitle because you can't have a presentation without a subtitle. And one day I'm going to create a presentation called Subtitles, Why I Hate Subtitles.
I'll be there.
Please do.
Front row.
And we bonded very rapidly with interactions during the presentation. And we shared a bond over the phrase, that sounds like an issue, not an ish me, which we'll talk about. A little teaser.
I like that.
So all that to be said, I came and talked to you afterwards and said, hey, come on to the podcast. Tell us about this little presentation you did and whatever else you want to talk about. So here we are. So Nikki and Sara, tell us about your presentation or whatever else you'd like to talk about.
I just have a story to share
okay.
because I love to, as like introvert that I tend to be at times and like don't love attention. So you're talking about that weird space where people sit like two and then one.
Mm-hmm.
I once went to a movie by myself. The theater wasn't that busy, but there were two men, 20-something-year-olds, who'd obviously come together, but God forbid they sit next to each other in the movie theater. So they sat with like a seat in between the two.
So you can put your coat.
Yeah. No, I went up, looked around, and sat in between them, and they both were like, and I was just like, just challenging.
Was that the only seat in the theater that was open?
No, it was an empty theater. It was pretty much empty, and I was just like,
she's challenging social norms.
I was just like, is this one taken? And I just sat down.
I can't, Sara, I can't tell you how uncomfortable I am right now just hearing that story.
Probably not as uncomfortable as they were.
Do you understand? Do you know the protocol, the unspoken rule in a men's bathroom about spacing at urinals?
Yes, we are aware of that.
Okay.
We've heard of this. Yeah.
Yeah, like you
challenged it in a movie theater.
Yeah, it was bold.
She is bold.
Only in Utah, I think, can you get away with that. I think in other places you might have been kicked out of the theater.
They were like, what?
Yeah.
How dare you ruin that social norm?
There's probably like a level of comfort and friendship intimacy that was there, and you might have just completely disrupted it.
I know. I should check to see if they're friends.
Will you text them right now?
You didn't become best friends after that interaction?
It was just so funny.
What movie?
But we can talk about Healing Out Loud.
But what movie was it? How long was the movie? Was it like...
Gosh, I wish I remembered.
Was it like the director's cut of one of the Lord of the Rings where it's like a 3.5 hour, like, we are here. This is an investment. We're here now.
And I probably fell asleep and I'm like drooling on this guy. It was a good time.
All right.
I just remember what it was.
So tell us about this presentation.
You guys, I would love to talk about Healing Out Loud. So I'm not sure if you guys were aware of this, but there is something that occurred. It was an event it was a panny, the pandemic.
Call it
what?
That. Please don't call it that.
What? During a panty? Stop!
Oh, my God. Sounds like the worst combination of a mani-pedi as a panty.
Yeah.
Yeah. Well, it's not supposed to sound cute. It's a panty.
Gosh.
Actually, it does make me think of penises.
Exactly. That was the next thing I was thinking of.
Anyway, in
2020, it was a really stressful time. And as acute care therapists, we were treating the COVID patient. We had to send our students home. It was a really stressful time. And
our kids were home from
school. I have only fur babies. Everyone knows these stories have been told. We know that it was a really stressful time. But when we started introducing students back into our world, we realized how impossible it was to teach students while we were actively broken.
Yeah.
And so we had to take personal steps to improve our mental health. Personally, I went on medication. I saw a therapist. I started adjusting a lot of things in my life. And, you guys, I love mental health. I am so pumped. Every time something crazy happens, like I'm stuck in traffic, I just turn to my husband. I'm like, dude, I just love my mental health right now because this would have just killed me before. And so we realized that once we were able to address our mental health and we started sharing that with our students, it allowed our students to engage better. It allowed them to learn better.
And our coworkers too.
Oh,
I mean, we would
absolutely
kind of share at staff meetings, and I think we had students leave the clinic rather abruptly, right? We got a mandate from central office of the VA that like all students had to leave, and we just had to be like, you're gone, and then coordinating with their schools and for CAPD to make sure everyone still got to graduate. And then they were gone for a while. We didn't have students, but we were able to treat patients and help each other and just like do those things. And yeah, as Nikki said, we had students come back to the clinic and we thought naively, but without context, like we'd never done that before, but we just thought, oh, they'll come back and we'll be as awesome as our jobs as we ever were and as passionate about teaching. And it turns out we were still trying to figure out. And now, I mean, we work in a rather small hospital with a small department. I think at the time there were 10 therapists, and we all knew each other's families and knew what everyone was doing on the weekends. And now we're inviting students that have come from across the nation who we didn't know what they'd been doing for the past few months. And
well, and also we had a lot of different perspectives on the pandemic. Like, what happens when you've been through the gauntlet of treating COVID in those rooms and seeing these people suffering, and then you have an anti-masker student come in? How does one cope with that?
And how do you meet each other's needs and try and respect each other's kind of differences, but be sensitive to the nature of acute care with immunocompromised? So we started getting pretty vocal in our clinic about how we were each feeling, and then coworkers as well. We'd have staff meetings each week, and we realized it was really helping to talk about it and to share with the students and invite their perspectives and everyone in the hospital. And I sit on a committee through the VA, a National Education Committee. We have quarterly calls for SCCEs and CIs, and we thought this would be a great topic. Or I think Nikki, an excellent presenter and a engaged individual. Look at you. So I invited her to perform.
It is kind of a performance, isn't it? A lot of jazz hands, a lot of spirit fingers.
Was so well. And then we just started doing more research and sharing in the classroom and realized how important it is to talk about things. And the pandemic set it off, but anymore we talk all the stresses. Yeah. Kids, man, that's mine.
How anybody does it.
But I mean, just talking about it and just the power of that. And so we presented at the acute care conference in Madison and the NCCE webinar this last year and ELC. So we're spreading the word.
And a couple of Utah.
I too, again, because we all went to the same presentations, I too am a big fan of mental health, and especially my students' mental health. This is where my research and talking about not only clinicians' mental health, but students' mental health. And I was thinking it was interesting, Sarah, you mentioned something about how you started talking about in your department meetings, just the sharing things. The question just popped into my head of, was this because, did all these changes or increased stressors or mental health crises come about because of COVID, or did we just get permission to talk about them because of COVID? Were they always there, and now we finally were just like,
Yes.
I would like to say column A, a little from column B.
Yeah.
For me, I hit my my mental health rock bottom because of the pandemic and a lot of things about the pandemic, but also, yes, we're realizing how many things that we were just coping with rather than like actually dealing with.
Yeah.
Well, and I think of that same light, Andy, and I've come back to this question a multitude of times on my own of like, what was it about that time that collectively humans, we all found ourselves in this space? And I think a lot of it was people were home more and kind of had to face a little bit more of, frankly, I don't want to say mortality, but even the fact we can go through life on a day-to-day and think you have absolute control over what you're doing. and how you're perceived in the world or how you respond to the world. This went poorly because I didn't sleep enough last night, or I ate too many candy bar X things, right? And that's human nature, I think, to just rationalize and feel some power over how things might happen. So yes, I think this was always there. And as Nikki said, we just kind of handled it. But 2020, pandemic, a lot of, social rights and political views, I think we're just on the main front. And we realized how powerless we actually are as individuals. And I think for a lot of people, myself included, that was a bit of a tailspin moment of, oh, darn it. And then you add up, I was also early 40s and had kids, and I didn't know how to be in charge of them anymore because turns out I'm not in charge of anything. Like,
Yeah. No, I mean, I think that's exactly right. And I think especially for, I don't know if I want to say this, I'll lump this into first world Western problems, but the pandemic was kind of this great equalizer. And suddenly we were seeing, obviously there were data coming out about the benefits of vaccinations and isolating and masking and things like that. But these aren't fail safes, and you can still get it and it can still kill you. It was very much not only are we dealing with this invisible enemy that we can't stop, we can only hope to contain, but now we're also stuck at home with people that we're not used to being at home this much with, and really testing the bounds of familial love in a lot of ways.
Yeah.
You say forever, for better or worse, but that doesn't mean like locked in your house for days,
like 24 hours a day forever. Yeah. So that was definitely hard.
So I love that. I'm going to call
The Great Equalizer.
2020 the Great Equalizer now. That's another t-shirt that we're just going to have to.
I don't know if that one's going to sell well, but go for it.
But I think that's exactly, it invited introspection, and a lot of us who have privilege in a number of ways recognize that, privilege or not, we're all in this together kind of thing. It was very telling.
I think the control thing is huge. Just anecdotally, as a pelvic floor therapist, in the 6 months after March of 2020, to your point about were these issues already here and then COVID just brought them out, a lot of patients that I've had constipation issues in the past, or I have some irritable bowel syndrome, and then now all of a sudden it hurts every single poop and my poops look like pencils, and I have no control over my external environment, but I can clench my butt.
Yes. Anal retentive. Absolutely.
When in doubt, clench.
When in doubt, buckle down. And I think also too, when all that external stuff, and then you just focus on you, and so you probably had more people being like, oh, that.
Yes.
Ooh.
And honestly, I think that right now is the time when I want to introduce my very favorite term. And that is chunks. Andy heard the chunks talk. Sara has heard this talk a number of times, but I feel like I want everyone to know about what chunks are, because I think it also relates to what we're talking about. Okay. So chunks.
Get ready, Catherine. Okay, get ready. Okay.
Waiting, Catherine. Are you ready to learn this?
I'm ready.
You already kind of know it. I'm just going to put it in a different perspective. So, chunks is the term that we use to describe the different chunks of information our brains can process at any given time. So, when we're driving, we're able to use one chunk for our feet, one chunk for our hands, one chunk for the pedestrian, one chunk for our audiobook, etc. And the average healthy adult has 7 chunks of information. So our folks with dementia, they can't walk and talk at the same time because they're losing their chunks. Our students, they're using chunks for things that we haven't used chunks for in years. So they're thinking about what they're saying. They're thinking about where they're standing. They're thinking about how to hold the gait belt. Oh, my CI is looking at me. Are they judging me? Oh, now they're on their phone. Are they bored? When really we're just ordering our shoes. I don't really order shoes as much as I order other random things. Cough drops. Anyway, but the reason why I bring up chunks mostly in this context is because the pandemic stole our chunks, and stressful situations, daily traumas steal our chunks. Yes, we had these issues. I've had generalized anxiety disorder my whole life, but the pandemic stole my chunks. So I wasn't able to use the coping strategies that I had used before. The pandemic stole my chunks, so I couldn't do the masking that I normally could. And so that made me just break down sobbing in the middle of staff meeting because I just did not have enough.
I hate that I laughed when you talked about crying. I'm really sorry.
No, I know that you love me as a friend, and
It says a lot about your relationship, though, I think.
I just remember those moments, and
Yeah.
it was a vulnerable time, and I laugh at inappropriate times.
Yeah, because I'm team vulnerability and she's team curiosity. Vulnerability, there's a reason I'm the president. It's because it makes her uncomfortable.
Yeah. Things that
And those are two terms that you harped on your, not harped on, that's not the right term. Those are two main themes of.
How do you feel, Andy? Why are we here? What is this now?
So Nikki is team vulnerability. Okay. And Sara is team, was
Curiosity.
it curiosity? I was going to say communication, but that's not right. It's curiosity.
Mhm.
The takeaway that I got from this was that they're almost two sides of the same coin. And they serve different purposes, but both work towards the same end. So Nikki is vulnerability, as she's kind of demonstrated here.
Yeah. And the reason why we chose these teams is because those are also things that both of us are working on being better at. I could be better when I have a student who is having a hard time and being like, tell me more about that. Why? Asking the question, why are they struggling? Why is this happening? And Sara could be better at team vulnerability. But I'm not going to describe why. You can describe your own vulnerability.
I'm going to throw you under this bus so you can do it yourself.
Hey, tell us about your trauma, honey.
Another time.
Okay.
But really, curiosity and vulnerability really came up for us as we went through this. I talked about all the times we've given some version of this talk. We continue to do research and then anecdotally have aha moments in the clinic or in the classroom. But in the research, team curiosity, because I can feel all the feelings, but I don't trust them.
Are you team trust but verify?
Let's pause. So I got to go check and make sure that other people have felt this before to make sure that what I'm feeling is real.
Yeah.
So, and
We all need our different versions of validation.
yeah.
Hey.
So, but curiosity and just the power of, vulnerability and sharing and inviting your story into the world, but creating space then for others to share theirs is really powerful. And so being able to share one story, so Nikki is a born storyteller and has no problems being in front of a crowd and sharing her perspective and isn't fearful of judgment. I mean, you're human, but yeah.
Well, if they do judge me, that is an issue and not an ishme.
There it is. There it is.
So she's always had those healthy boundaries, and I think it's really refreshing, and other people don't. And so I have found that in my life I get comfort from or I like to listen to other people and draw out their stories where it helps me validate my own experiences and invites them to share so that I can understand maybe why that patient is not being nice today or why my kid today wouldn't go into his climbing camp. I don't even know, but then turns out I had to get curious, and he had a substitute teacher and it was a hard day. Aww. And he wasn't feeling very empowered to be his own little being.
When I was in the clinic, I worked in a setting that was largely TBI rehab. That's kind of my, those are my people.
Nice.
Okay. The Rancho level 4s, those are my people. But I've talked with my students a lot about the advice that was given to me as a new clinician, which is, I still remember it very vividly and I share it a lot. But essentially to be able to recognize and take that step with your patients, with the agitated patient, to understand why they're agitated. Because the way it was explained to me was that an agitated patient is trying to communicate in a way that they feel like will be heard. And we talked years ago with a therapist, not years ago, listen to us, a while ago with Deborah Sheldon, who's a PT in Chicago. She's super awesome. and was talking about the phenomenon of, she deals with a lot of chronic pain patients, and talking about how if you're saying something to someone and they're not responding, what do? You talk louder. Okay. If you're trying to communicate to someone and they're not responding, you talk louder and louder and louder until someone acknowledges your presence. And so if you have a patient who is being agitated, that it's not about you, it's not about some interaction that you had, it's because maybe they didn't get the grilled cheese sandwich they wanted for lunch, and now they're mad and no one's listening to them until they start smashing things out, something like that. There's a communication thing. But if you're not curious, you will never find out what that answer is, and you will never be able to meet their need. All you'll do is try to intervene and be like, stop.
And then it just kind of.
Yeah. And that never helps.
Escalates the situation.
Yeah, exactly. And another thing that I am a big proponent of is trauma-informed care. And and so both vulnerability and curiosity are incredibly important to recognize when a patient has these situations where there might be triggers. So talking to my students about things that even just today, I was doing a lecture about how to do an oculomotor assessment. Okay. And so for VOR, you put your hands on the side of the, right here, and then you're doing this thing back and forth, and how important it is to talk to your patient ahead of time and get consent so they know what's going on. Because guess what? Some people don't like a stranger putting their hands on the sides of their face because maybe they had a bad experience with that in the past, things like that. So if you're not curious about those things, you will never know, and you will do an average job at best and a poor job at worst during your interventions.
And I think you brought it up earlier too, Andy, and as I hear it, we give this talk and we yes and each other all day, but to hear other people put it into terms, the two-sided coin, I think in order to be curious and ask those questions, you have to then be vulnerable and invite any sort of feedback or any sort of information. Yeah. So I think it's just, they go hand in hand. And then there's a host of other things that we have soapboxes about, but we just didn't have time. Oh, I like that. TBI.
Well, and I also think that I'm so sorry, but this also just reminds me of the assumptions thing, like where curiosity comes in as well. Basically, if you are just going to assume that this person is just freaking out over nothing, or this person is agitated for no reason, that's why, I just love what you said, because you can't be an amazing therapist and make assumptions about your patient.
I would also relate this back to that chunks thing and the new student kind of stuff, because just to any new clinicians or students who might be listening to this, when you are trying to remember what the VOR test is and you aren't familiar with working with someone who is agitated or has an altered mental state, you might not be perfect at informing them before you're doing something or whatever. That's part of the learning process too.
Yeah, and afford yourself that grace, even a seasoned clinician, because we each have days where you're just in the clinic and you're distracted because chunks. Chunks.
Yeah, because chunks.
Because chunks. We just say that.
This is why we talk about it first thing, so we can just use this shorthand.
Just chunks. But affording yourself that grace, even, and Nikki does a really great job. We let her do the chunks talk because she does it so beautifully with each student. But we have a new student started today, and Nikki's talk tomorrow. But even Nikki teaching us about chunks, I think as clinicians we can see that on our students' faces, and then even affording ourselves that grace, I said,
and also telling your students to allow them afford themselves that grace, because when we think about how many mistakes we made when we were students or when we were novice therapists, and there were so many years where I wanted to protect my students so bad from those bad experiences. I wanted to give them every mistake I ever made so that they could avoid them. Yeah. And then I realized that's not something you have control over.
Yeah. Dr. Nikki Pappas and Dr. Sara Wallace are physical therapists and educators based out of Salt Lake City, Utah. They are passionate about caring for their patients, but also their colleagues and themselves. We had so much fun talking to them that we had to split this episode into 2 parts. The conclusion is coming up next in your feed. Waves is a production of APTA Michigan and is co-hosted by Dr. Catherine Klein and me, Andy Wicks. You can find us online at www.aptami.org/podcasts or on social media at APTAMI Waves. You can find us and subscribe to our feed anywhere you get your podcasts. And don't forget, that you can get PDR credit for licensure renewal if you are a PT or a PTA in Michigan, just by listening to an episode. See details in the show notes. As always, thank you for listening, and may your documentation be done on time.